Hello and welcome to IBS in the specialist area medicine. First off, we'll start with a few questions. Question 1. What criteria do you use to diagnose IBS? If you get stuck, try and use the process of elimination. The answer is B, Rome 4 score. We will talk about this later and how it comes into play with IBS. Question 2. What can be mistaken for IBS? Colorectal cancer, inflammatory bowel disease, celiac disease, or gastroenteritis? Think of the signs and symptoms they may have. The answer is all of them. We will come to explain how their symptoms and signs may relate to IBS. However, you would need to take a history examination and do investigations in order to eliminate any of these diagnoses. Is there any histological changes in IBS? The answer is no. IBS is a functional problem, as we will come to later on to define IBS. What we will be talking about in this video is what is IBS, symptoms and history, epidemiology, investigations and differential diagnosis, the clinical examination, management, and a few more questions to summarize what we have done. So what is IBS? It is a functional disorder of the GI tract characterized by chronic abdominal pain and altered bowel habits. Functional means symptoms occur in the absence of any demonstrable abnormalities in the digestion and absorption of nutrients, fluids, or electrolytes. So there's no physical cause. The key in IBS is altered bowel habits. The mechanism of IBS is not particularly understood, so diagnosis is arrived at having excluded organic diseases presenting with the same symptoms. They have no histological abnormalities. And what we use to diagnose IBS is the Rome 4 Diagnostic Criteria. It involves abdominal pain for more than or equal to 1 day weekly in the last 3 months associated with 2 or more of the following: defecation, resulting in lessened pain, change in stool frequency, and stool consistency. Some of the symptoms that people with IBS have are altered bowel habits, recurrent abdominal pain, bloating, mucus in stool, and incomplete evacuation. In the history, you might want to ask a few questions such as, do they get stressed often or do they suffer from anxiety? As stress and anxiety can trigger IBS. Epidemiology. So the prevalence in the general population is 10 to 20%, and it commonly affects ages 20 to 30 years. Women tend to get it more than men, with a ratio of 2 to 1. So, as we had mentioned earlier on, it is based on elimination. You'd want to eliminate any other organic causes that may be causing similar symptoms and signs as IBS. So for your investigations, you'd want to do an FBC to eliminate anemia, white cell count and inflammatory markers such as ESR and CRP to eliminate infection and/or inflammation. You'd want to do a UNE to check for dehydration or electrolyte abnormalities, and antibody testing such as EMA or TTG to check for celiac disease. As we have mentioned earlier on in a question, some of the differential diagnoses of IBS are IBD, celiac disease, malignancy, or gastroenteritis. So, IBS, you'd want to make sure that you've eliminated all of these causes before you reach IBS as your final diagnosis. Some of the managements you'd need to do when a person has IBS, you need to educate the patient. You need to inform them of why they are getting these symptoms. Maybe you want to do lifestyle and dietary modifications such as FODMAP. In this case, you'd involve a dietitian, as FODMAPs is very particular in the food sources. So the patient may get stressed and get anxiety because they are not sure how to manage their symptoms. You might want to give them antispasmodics, bulk-forming laxatives, and loperamide. On clinical examination, they may have some bloating present at time of examination if they have bloating at that time. Otherwise, examination may be normal, and you may get some mucus in their stool. To summarize what we have done, let's start with a question. A 26-year-old female came to the GP complaining of bloating. On further questioning, you find out her bile habits alter and she gets mucus in her stools. What is the most likely diagnosis? Could it be A, IBS, B, gastroenteritis, C, pregnancy, or D, colorectal cancer? Remember our key symptoms. The answer is IBS. However, pregnancy should always be considered in a young female patient of fertile age until you eliminate it as a cause. So, question 2. What scoring system do you use to diagnose IBS? Is it A, Rome 3, B, Child-Pugh, C, Curve 65, or D, Rome 4? Remember, try to eliminate. The answer is Rome 4. Rome 4 is an updated version compared to Rome 3. Last question. How many months does the Rome 4 diagnostic criteria need in order to help make a diagnosis for IBS? Is it A, 7 months, B, 12 months, C, 3 months, or D, 4 months? The answer is C, 3 months. Remember, we said it is more than or equal to 1 day weekly in the last 3 months. Thank you for listening to this presentation.